Doc, I respect what you do, but see this stomach ulcer you're talking about. But it cannot be me. Because I eat very well. And I mean very well. If you tell me I have something else, then I will agree. But this ulcer, no.
Hmm. It will shock you if I tell you this. That not eating is not a cause of ulcer.
Like seriously?
Late meal will only aggravate an already existing ulcer. You already have an ulcer, so when you do not eat, the symptoms will now manifest. That is the pain. When there is a sore in the stomach and you eat well, the food will dilute the acid. It will actually get the acid busy and it won't have time for your wound. But when the stomach is empty, the acid content will then be free to contact the wound. And then the characteristic pain that we have described will be felt. So what then are the causes of stomach ulcers? The commonest cause of peptic ulcer disease is an infection. Infection accounts for about 70 to 80% of most ulcer cases.
Wow.
Yes, that meant. An infection is by an intestinal bacteria that we call Helicobacter pylori. Yes, helico, but for short, just call it H. pylori. You see that guy, H. pylori?
Yes.
He's a bad guy.
True.
It has its way of surviving in an acid environment. And so it can be in your stomach for years.
Really?
But the fact that stomach ulcers, majority of them, is caused by an infection, means that this ulcer can be treated.
Let me say that again.
The fact that majority of ulcers are caused by infection simply means that these ulcers are treatable.
That's good news then.
A test for this infection is therefore essential in all patients with peptic ulcer. And that's how we're going to be able to determine if yours is caused by an infection or not. Another cause of stomach ulcer is the prolonged use of certain drugs. First is a class of drugs that we call NSAIDs. NSAIDs. These drugs are used in the control of pain, inflammation, and fever. Frequent or excessive use of these drugs can break down the defense mechanism that we talked about earlier and make the stomach lining susceptible to damage from stomach acid. People with chronic conditions that warrant frequent use or prolonged use of these pain-relieving drugs are at a greater risk of developing a stomach ulcer. If you're in this category, don't just abuse this set of drugs. See your doctor so he or she can prescribe other alternatives. One can also develop ulcer when these drugs are taken without meal. That is when they are taken on empty stomach. And that's why your pharmacist, before they dispense the drug, or your doctor before he writes a prescription of those drugs, many a times we ask you if you have ulcer or not, because it can cause ulcer and then it can worsen already existing ulcer. So even if you don't have ulcer, you will need to take these drugs with meal. Examples of them include ibuprofen, diclofenac, aspirin, Velvin, and the like. H. pylori infection and the use of NSAIDs account for the causes of most of the peptic ulcer disease. Another drug class known to cause peptic ulcer are steroids. Examples include prednisolone. Prolonged use of steroids can make you develop ulcer. Using these medications, the steroids, in combination with NSAIDs, now even makes the matters worse. That is, it increases your risk of stomach ulcers. Another important recognized cause of peptic ulcer is chronic stress. And when I mean stress, I mean all forms of stress, physical or emotional. Stress-induced ulcer is well researched.
An example of it
Is named after the researcher that studied it, Collins.
It's called
Collins ulcer. Less commonly, there are other causes of ulcer, such as tumors that can increase acid production in the stomach. Stomach cancers can also cause ulcers. Cancers can erode into the stomach, creating large ulcers. And another example is ETC.
Needful to mention that there are some ulcers whose cause we don't know. And in the medical world, any condition whose cause we don't know, we call idiopathic. So idiopathic causes means we don't have an idea of the causes of these ulcers.
In all of this, I have not mentioned that not eating causes ulcer. Like I said earlier, it only aggravates an already existing ulcer. When you have ulcer and you eat frequently, you eat small quantity of food and frequently, it will get the acid in the stomach busy, and so it won't have time to contact the wound. So as the wound is left, without insult, it will naturally heal, provided there are no infections that can hinder the healing. Try and watch the other videos in this series. Remember to like, share, and subscribe. And don't forget, your health comes first.